This video is going to demonstrate how to put in a Malyugin ring. The Malyugin ring has been a wonderful benefit to cataract surgeons over the last decade or so since Boris Malyugin invented it. Note that it goes into the eye effortlessly with the introducer. It has 4 attachment points which are like little bobby pin endings, and these are clipped onto the iris in 4 positions. It's of great benefit to put a bit of viscoelastic under the iris, which does make it easier to insert, something I haven't done here because this was one of my earlier cases. The first 3 points are relatively easy to get in. Sometimes the 4th though is a little bit out of reach, so a little bit of logistic foreplanning can help. When you put the ring in, be careful you don't prang the anterior capsule. The Malyugin ring is then positioned to be centered over the cataract, and the cataract procedure can begin. Before you begin the capsulorhexis, don't forget to refill with viscoelastic. You can then proceed to do your cataract in whatever is your chosen method. In this case, I'm starting the cataract using a 23 gauge needle to begin the capsulorhexis, although latterly I just dive straight in with the capsulorhexis forceps. Get a mind's eye view of how big you want the capsulorhexis to be, just as you would with a normal cataract. Note the size of the Malyugin ring. This is a 7mm, which equates to a 7mm pupil, which is about the perfect size to conduct an uneventful cataract surgery. Following this, we're going to now demonstrate how to take the Malyugin ring out. Going towards the end of the procedure now, you can see the lens implant is being put in using wound-assisted entry, and the lens, which in this case is a Technis, is unfolding nice and slow, just the way you want it to be. You can go about positioning the lens in the normal fashion, orienting the toric markers just as you normally would. Don't forget to recheck the toric markers at the end of the procedure after the Malyugin's been released to make sure that the lens hasn't moved in the bag. Then with the OSHA instrument, we unhook the Malyugin ring from the iris. One by one. And whilst you're doing this, be careful you don't put too much traction on the iris, because it is possible to tear it off the base and cause a hemorrhage when you do this. Getting to the last of the rings, the Malyugin ring is now free. Using the second instrument, the OSHA device, you can place the Malyugin ring onto the introducer, which is now an explanter, has a little tow truck hook, and it pulls it into the body, and away we go. Beautiful, complete.